Shanawaz, let me just take a minute to introduce you formally.
Sure.
It is my pleasure to introduce Dr. Shanawaz Khan today. He's obviously very well known in the community, and mashallah is involved with all area 4 massages that I know, from ISD to the one in Elkton and Tarbiya Masjid Isa, and he's spearheading the masjid in Middletown, and we're fortunate to have him. This is his 4th presentation since COVID started, and last time when we asked him to present, the question was that if the J&J and Moderna will get approval, is one better than the other? There was a lot of confusion. He clarified all that. Now we are in a similar spot where we are saying, okay, a booster shot, we can get it from Pfizer, but those of us who got Moderna mostly in this area, some Johnson & Johnson, what should be the best route for us? So it's all yours, Shanawaz. Go ahead.
Assalamu alaikum. I hope from my last lecture, everybody's been safe and sound and enjoying, safety with Corona after listening to my last lecture. However, there's a lot of updates since last time I talked and kind of explained about the Corona situation, vaccines, and the treatments, all those things. So I think we're starting a little late, so I'm going to try to speed up the process so that we'll leave a little bit time after the presentation for question and answers. So without further ado, I'm going to start. So as you can looking at the screen, Coronavirus Updates, this is my 4th lecture, and I hope you get just as much information out of this lecture as you have before. If not, just hold your questions until the end of the presentation, and then I'm going to try to explain if you still have some concerns or questions. So coronavirus. It's a little quick update on the origins and the history of this. We all know that started in Wuhan, China, the first case that was discovered back in 2019. Currently, we are in 2021, and it's right now a global phenomena. So that's why I was calling it a pandemic, because it's all over the world. Mutations causing a lot of problems in the vaccine efforts. Vaccines been developed since last year, and they've been so far up to like 1 year mark. And we've learned so much from vaccines. So I'm going to try to explain those, what we're going to do. Right now, we have 2 populations roaming around in the US. Ones are vaccinated and the other ones are unvaccinated. So what's the future lies for both of them, and how can we try to get as many people vaccinated so that we can all protect each other? A lot of questions about public's reluctance to get vaccine. What are the new guidelines for the vaccine? Any testing updates? And then alternative therapies. So I'll go with a little fact check, Q&A session in my presentation, trying to, debunk the myths versus facts, and then Corona pill. Yeah, stay tuned for that. So that's a new topic that we're going to be briefly highlighting in this presentation too. So far, Corona has killed 700,000 people, which is matching the death toll and actually surpassing the death toll of Spanish flu of 1918. So think of it. Last time we had such a massive pandemic was in 1918, and history is repeating itself. And in future too, but I think that with the information and knowledge, we can overcome all these obstacles. So that's why I've urged you to listen to me a little bit more carefully, so that we stay up to the date on all the latest stuff and then get benefit from that. Delaware has the lowest number of deaths since it's a small state, so stats are also small. As you can see in the chart, Maryland is the next big, and then Pennsylvania is even bigger. Worldwide, you can see the death toll is really, really staggering. So this disease is not going anywhere, and we should take notice, take precautions, and stay safe. Okay. Symptoms currently: loss of taste, loss of smell, high fever, body aches, nausea, vomiting, and diarrhea and malaise. As if you think you have a flu or something like that, do go get tested so that you'll be safe. How can we stop the mutations and the virus right now? So first of all, first and foremost is get your vaccines, because if you haven't had your vaccine by now, I think I encourage you to get one, because that's one way of safety for you and your loved ones right now. Wear a mask if you're in a crowded public enclosed spaces. So that helps you protect somewhat. So that's basically, a lot of people say, well, masks doesn't work or masks do this. It's just creating a little bit of a barrier between a person who could potentially infect or a person who can. So N95 masks are recommended because they slows down the spread, but a lot of people wear masks, that are not N95 that can still spread more germs than 95, but so there's some sort of a barrier up there. So do wear a mask if you're in an enclosed, crowded place. Stay 6 feet apart, because that helps people from catching corona at this time. As I mentioned earlier, avoid crowded places and poorly ventilated places, and indoor spaces where air has been recirculated through the HVAC system. So you might get a little bit more exposure of virus compared to being out in the open. Wash your hands. That's the most important key factor. If you keep washing your hand, that will limit the spread of the germ to the utmost. Right now, if you do have these symptoms and you're trying to avoid that, what to do? There's a couple of tests that are out there. I'm going to just briefly go over those. There's RT-PCR test. That is the most accurate. The results are available nowadays from 24 to 48 to 72 hours based on what labs is running them. But RT-PCR is more accurate than any other test out there in the market. So if you think you have corona, if you have symptoms, or you've been exposed to somebody who has corona, do go get this test done, because this gives you the more accuracy. There's also another test out in the market, and also Walgreens and other drugstores are selling at-home kits for this test called rapid antigen test. So it is available to buy, to take it home if you think you can get to the place or a clinic where they test you for corona. You can take it home and at least get checked out if you think you have symptoms. So take advantage of those available resources too. However, rapid antigen test, the results are available in 15 minutes, but the results are also less accurate compared to the RT-PCR. So I encourage you to get, if you're gonna get tests, get RT-PCR. Otherwise, you can get both tests done. That can give you early and later results. However, confirmation would be more authenticated that way. However, if you do have symptoms and you're done, make sure you isolate yourself. And once you're past your isolation time frame, you can get a test called SARS-CoV antibody titer test. So this is antibody, not antigen test, compared to the above test that I wrote as antigen test. So antibodies are the 4 cells that are made by the body after being exposed to the virus. So this will tell you that how much body responded to the virus and how much immunity you have. So this test will tell you if your vaccine was good in creating immunity, or if you had developed immunity from the prior infection. This test is not routinely done, so in certain special circumstances, this test has been ordered. Delaware website has this quarantine versus isolation guidelines. I'm going to go over that a little bit with you. So I took a page from the Delaware website. You can all welcome to go at delaware.gov and get this isolation poster, which can tell you how, if you do get symptoms or infection, what to do, how to quarantine yourself, how to isolate yourself. So, this is very important that you can go and check this out. So ending isolation and precautions. So for most children and adults who are symptomatic, with the COVID vaccine infection, COVID infection can discontinue after at least 10 days or 2 weeks after the resolution of the 24 hours after the resolution of the fever. So that's for normal people. However, if you're severely ill or if you're that sick that you needed hospitalization, ventilation support, the isolation guidelines or quarantine guidelines are extended up to 20 days or after 24 hours after the symptoms resolution. So people who are exposed or infected or asymptomatic, they're also encouraged to do like a 10 days isolation quarantine after, or if they got tested from the test time, it needs to be 10 days. So keep that in mind, that not from the start of the symptoms, but from the time the test was positive, you have to do the 10-day. Now, symptoms can start earlier because the virus has an incubation period of 4 to 5 days. So if you've been exposed to coronavirus, you may take as long as 4 to 5 days to develop symptoms in some cases, but most cases usually happens earlier than that. So if you recovered from COVID-19 and continue to have upper respiratory symptoms, usually you may have virus antibodies that will protect you against 3 months after the illness. So a lot of people have been asking, what are these variants and what do we do about that? So I thought I'll make a slide about that. There's different types of corona variants that are out there. Initially, when we had corona last year, most of the variants were UK variant, which you can see in the label as an alpha variant, and South African variant, which was a beta. And so those are the most common variant that was around there. But then this Delta variant came in. This was first isolated in India, and it's I'm going to talk a little bit more about it in my next slides too. Then there's Lambda variant, which is also on the horizon. We've been watching it with CDC very closely. It started in Peru, and then it has now spread to 30, and it's very contagious. So keep in mind that all these variants are coming at a rapid pace because of mutations. Then there you have Kappa, and then the other one that is right now in the news is the mutation, which is first detected in Colombia, and that's been ravaging South America and Europe. So Delta variant. So from the CDC, it is compared to original strain is a lot more infective. So 2 times more infective than the original. So that's why if somebody catches this variant, they can infect a lot more people. Even if you're vaccinated, you need to be worried about this thing, because a lot of times, if you, depending on where your immunity status is, you may still get affected by Delta variant. So as you can see in the slide earlier, you knew how coronavirus was infective. Right now, the Delta variant is twice as much potent. So it will affect more people. So that's why it is kind of very concerning that how to contain this virus. So I think I need to go back. All right, so sorry, my computer just had a hitch. So Delta variant, so like I said earlier, more contagious, and it causes in some cases more severe illness than other previous variants. Most of the people that are affected more severely by this is unvaccinated people. So they are the most concerning group right now that are walking among us. So I encourage those people to reconsider unvaccination status and try to get vaccinated at the earliest, so that we can all have proper immunity throughout the community. Fully vaccinated people, like I said, that still can have a breakthrough infections from Delta variant because of its infectivity. So it is that potent that even vaccinated people are not immune from that. So that you can still get it even if you did get the vaccine. However, what vaccine does, it kind of slows down the virus progression. You can get over your symptoms more quicker and less worse than if you weren't vaccinated. So there's treatments if you do get infected and you're symptomatic. There's a criteria, but what is available right now is a monoclonal antibodies. It's an IV infusion that is given in the hospitals, infusion centers right now. So if you have symptoms and you have the criteria, which I'm going to go over a little bit later at the next slides, and tested positive within the 7-day period, and have a high risk disease status or severity of the disease. They're not sick enough that they need to be hospitalized. They can benefit from a monoclonal antibody. So if you think you are positive and symptomatic and you have high risk status, do go ask your doctor about the monoclonal antibody infusions. That might help you in that sense. People who previously received passive antibody therapy, there's no data and safety about the vaccines who are infected right now and got the vaccine, that how much that is going to be part of your immune boost. However, that reinfection is really uncommon after the antibody infusion within 90 days because you develop your own antibodies. So most people are encouraged after they receive the antibody therapy with post-COVID infection, or they have, so they should wait about like 90 days prior to getting a vaccine or another antibody status, because that will help them kind of guide a little bit in their immunity. So the vaccines, there's 3 vaccines currently approved in US, Pfizer's, Moderna, J&J. Pfizer is 2-shot, 21 days apart. There is some side effects, I did mention it, which I'm gonna explain a little bit more detail later on. Myocarditis and pericarditis with Moderna and Pfizer. J&J is a single shot, have the lowest effective immune response from the body compared to the top 2 vaccines. The biggest problem we've been facing with that is the blood clots, DVTs. I'm going to go a little bit more in detail later on about these things too. Anyone who has allergies to any of the vaccines, usually after the first shot, they should not be getting these vaccines for second, or at least talk to your healthcare provider before you can assess your options about getting a second dose. And again, one more time, I'm going to say that these vaccines are not to treat acute infections. They are to create immunity, not for acute treatment. If you do need acute treatment, like I said earlier, monoclonal antibodies probably be the way to go, or talk to your doctor, what would your options be? So these vaccines may cause local reactions, pains, body aches, injection site, swelling, redness, fatigue, but usually they're self-limiting compared to a lot of belief that, which I'm gonna go over that in later on, about that weird side effects that people have been posting it on the social media. Most of these symptoms goes away within 2 to 4 days. So a couple of things that, again, same, that if you receive a vaccine, should you get a second dose close to the recommended time? So encourage that the timing that has been given is utmost important. You should not get a vaccine second dose, especially for Pfizer and Moderna, earlier than recommended time, which is 28 days or 21 days in Moderna. So keep that in mind. You can, however, delay the second dose based on, let's say, if you got your first vaccine and you got infection with Corona, you have to wait until your Corona infection goes away and your quarantine and isolation time has passed before you can even think about getting a second dose. In that case, if you're not sure, do talk to your doctor about that what are your options are. However, the CDC recommends that you can delay the second shot 42 days past your first shot. You can delay it up to that long just to get a second dose, and it will still create immunity properly. Severely compromised people do need a booster after a second shot, which I'm going to explain a little bit more in detail. Timeline for vaccine response, usually they say 2 weeks after any of these vaccines, whether it's Pfizer, Moderna, or J&J. 2 weeks later, you should see some response of your body's immune system, trying to make some sort of immunity against coronavirus. Before that, you're still in a highly infective, susceptible phase, not infected, susceptible phase where you can still catch corona. And a lot of people got corona during that time frame. So like I said, again, do common sense and wear a mask, wash hands, and quarantine if you, or isolation if you think you may be exposed. All right. So like I said, again, before that, vaccine is not for acute management of infection. It's to create immunity. Unvaccinated people are still the biggest group right now that we're having a hard time convincing that they need vaccine so that they can be vaccinated. So residents of the nursing homes, healthcare workers are at high risk because unvaccinated people they come across would be carrying any of these variants can also make them sick despite having all healthcare workers being vaccinated. So if everybody gets vaccinated, I think that would be a great asset for the whole community for as a safety wise. So do go get vaccinated, please. So booster, a lot of people have been asking, what is this booster? When should I get it? What is it all about? So some people are also calling it a third COVID shot, which is also kind of true because that's exactly what it is. So Pfizer is the only one that is approved for the booster. Moderna and J&J haven't been approved. However, things may change come later part of this year or early next year that they may be approved for those booster too. However, currently only people who got Pfizer are supposed to get a booster. So please don't go and ask that if you need a booster, just if you have Moderna or J&J. So booster is approved for 6 months after your last Pfizer dose. So you have your vaccine card. It shows your last date of your second shot. And from that date, you can count if it's been 6 months, you can go get it. Currently, the government, states, federal government and states are encouraging people 65 and above to get definitely this booster. More younger crowd, they're still encouraging it after all the 65 years old that has been vaccinated. So however, if you do want it and then you had the Pfizer shot, you should go and get it too. And the government and the state won't give you as much of a hard time right now because the availability of shots are still pretty good right now. So these boosters may become a yearly thing like we've seen with the flu virus because of the mutations. All these variants and mutations in this virus, just like flu virus, they may become a yearly thing too. So in order to keep everybody safe, you may see in future that you may have to go every year to get these boosters. So boosters, I was talking about earlier, who is eligible for these boosters? So like I said, 65 years and older and residents of long-term care nursing home patients are definitely recommended to go get this booster. People with who are 50 to 64 and with the underlying medical conditions I did mention in the slide what conditions are these. To name a few are cancer, chronic heart failure, kidney disease, diabetes, Down syndromes, HIV, pregnancy, and all these things. They should be also encouraged to get their booster shot too. CDC recommends that people who had the Pfizer shot should get the booster 6 months from their second shot. However, Moderna and Johnson & Johnson still not recommended to get booster, but come later this year or earlier next, hopeful that they're also going to be recommending for those people too. The people 18 to 49 with the underlying medical conditions are also encouraged to get a booster, but all these, as we get into the younger population, the risk factor determines your eligibility for booster. People who in the younger group who are first responders, healthcare workers, firefighters, police, or any kind of workforce that are essential, like daycare workers, teachers, U.S. Postal Service, public transport people, and grocery store workers should also be encouraged or advised to go get a booster too, because they are at high risk from exposure. And if they have an underlying medical condition, that makes it twice as much important for them to get that. So a lot of people say these vaccines been only out for a year. Why should we push them? We don't even know what kind of side effects and all these things they cause. That is true that we're still learning about the vaccine and all that thing. However, vaccine preparation process has been going on for for a very long time. So we can make vaccine quickly. However, the thing is that it hasn't been tested for this virus. However, the ability to prepare vaccine quickly was already in place for a long time. We just haven't had a virus bad enough that can cause this kind of vaccine problem. Sorry, not vaccine problem, a virus that can cause this kind of pandemic. So vaccine process does go through multiple processes, as I mentioned, from development to trials, human trials, and then tracking all these things. What are the ingredients in COVID vaccine? A lot of people say that, we don't know what's in it, so that's why we're not going to take it. So as I mentioned that earlier too in my other conferences and places, that this vaccine is already been prepared, keeping that in mind that it doesn't have any kind of antigen that can provoke a body to have more reactions. It's devoid of any metals, iron, nickels, eggs, gelatin, latex, and also any kind of carbon nano tubes or any kind of microchips to mention. Antiviral therapies are out there and they are okay to be given with COVID-19 vaccine. So that is one thing. A lot of people say, if I take antiviral therapy, would I still need the COVID-19 vaccine? And the answer is yes. The mRNA vaccine, I'm just going to go over that. Only 2 of them are mRNA vaccine. One is Pfizer and Moderna. They work differently than the regular vaccine like J&J has. They have a little piece of a virus, not a whole virus or a crippled virus that can cause like a immune response or boost an immune response so that they can be triggering the body into mimicking how an actual virus would behave. So when these vaccines do cause a little bit of a side effect, that means your immune system is recognizing that piece of protein or mRNA that you've injected through the vaccine and creating immunity. And when the actual virus get exposed to the body, they're ready for that. So questions a lot of people have: does the vaccine have microchips? And the answer is no, it does not. So to contrary, none of these vaccines have any moving parts or any chips. There are some people, and even in my clinic, that came in and said that, well, I've been magnetized because I got the vaccine, and they try to put the phone on their arms or chest and try to show that they're vaccinated. There's a lot of YouTube videos that showed that people have been having light bulbs that kind of glow after they got the vaccine at the site when they put the light bulb on it, and also they put the magnets on it that showed like magnetism, but that is not true because these vaccines don't have any kind of metal. A lot of people ask, well, if I get a vaccine like other vaccines, would that shed? Because there are some live virus vaccines like a varicella vaccine or other vaccines that do have a live virus. And when you give them, so that's this crippled live virus, but it doesn't cause disease. However, since it's a live virus, it does shed in the fecal material and the urine and saliva. So those people are told to be safe and try not to be around people who are unvaccinated. These vaccines are safe and they don't shed. So keep that in mind. So that is for the other vaccines. That is true, not for this vaccine. So a lot of people say, well, this vaccine will give me COVID. And the answer is no, these vaccines are just pieces of a virus. You need to have a whole virus to create a disease process. Now, after getting a vaccine, you may be exposed to a whole virus and through the community or your surroundings, which can be a different situation. However, these vaccines are safe and they don't cause a disease process. So a lot of women ask, will that in any case also alter my menses? The answer is no. These vaccines are not causing any. However, the stress of not having vaccine or other life stressors can cause There's a lot of people have questions about testing, that will the vaccine is going to make the test positive? And the answer is no, because the vaccine purpose is to create antibodies, not to make the test positive. However, the test can be positive due to other reasons where you may have acquired virus from community or other sources. So the goal for me is to kind of convey that the test is, regardless of the vaccine, can become positive or negative. However, vaccine does not cause the test to become positive. So they said that how long do I have to wait a flu shot since it's a flu season? We see that a lot of people have been asking questions. Do I need to be vaccinated with flu? Now, earlier in my previous lectures, I did mention, because the CDC guidelines were different, that for any immunization, you have to wait 2 weeks with the prior or after the Coronal vaccine. That has been changed now. Since the vaccine's been out for so long, and they've been seeing with other vaccines that there's no reason to delay the flu shot or Corona vaccine. You can get both of them on the same day. So get your vaccine for flu too, since it's a flu season started. They said, do I need a vaccine if I have recovered from Corona infection? The answer is yes. Because there's so many variants out there, you still need a vaccine to protect you against all the variants. There's a lot of people, they said that people who are had the monoclonal antibodies, should they wait? And they say usually they have to wait about 90 days to get the vaccine. However, if they haven't been given monoclonal antibodies or they had coronavirus, then they should get at the earliest. They shouldn't be waiting. So I have mentioned this before too, that people who have a coronavirus should not be getting vaccine. They should delay until the quarantine and isolation has been done, so that they won't infect the healthcare workers who are giving vaccine, and also don't infect anybody else. However, if they do require healthcare, they need to let people know that they are positive, so that they can be taken care in proper manner. So they ask how long the protection from the COVID vaccine lasts. So that question comes up over and over again in the past and now too. So everybody's immune system is different. So it's hard to predict that how long everybody after vaccine develops immunity, and then when should be the right time to get a booster or anything like that. So that's still been debated over and over. There's no actual answer for that. However, they do say that if you haven't been vaccinated, you need to get vaccinated, so at least you'll have some sort of immunity. So a lot of people ask, which vaccine should I get? Can I choose a vaccine? And the answer is, initially when the vaccines were limited and the supply was very kind of stringent, you didn't have a choice of what vaccine you can get. However, right now the supplies are more abundant, and you can get it more easily. You do have a choice of what vaccine you can get. However, CDC does not say that one vaccine is good over the other. If the FDA has approved it, they said that that's all it should matter. You should get a vaccine one way or the other. The things I was talking about with Johnson & Johnson, people with the rare conditions should be a little bit more cautious about getting Johnson & Johnson with the DVT and things, which I'm going to talk about a little bit more later in the other slides in detail, that why it is important. So people with those rare conditions should have another option of getting Pfizer or Moderna, which doesn't have those kind of problems. So they said, if I'm vaccinated, do I need to wear a mask? So if you're fully vaccinated, right now the recommendation is you can walk around without a mask. However, it is better to keep the mask on, especially in the indoor crowded places where you don't know who's carrying what kind of variant virus. So you can still get infected by it. However, if you are in outdoor spaces and you're 6 feet apart from everybody else, you don't have to wear a mask compared to last year at this time, where it was mandatory to stay like outside most of the time and then wear a mask and stay 6 feet apart too. Delta variant, like I said, is very infective. So even if you got vaccinated, don't think you are completely immune. However, vaccine do play a role with Delta variant too in creating a less severity of the disease and less hospitalization and less morbidity and mortality wise. If I have the underlying condition, should I get the vaccine? The answer is obviously yes, as I mentioned in earlier slides. So the women who are thinking if they're going to be pregnant one day, or if they're currently pregnant, or if they're nursing their young ones, or they're still in a phase of planning to get pregnant, the vaccine is recommended. Once you get vaccinated, especially for pregnant women, the CDC encourages people to enroll in a V-Safe. So when you go to CDC website, you have a V-Safe program. I'm going to talk a little bit more about that too. This is to keep track of who is having any kind of side effect from these vaccines while they're pregnant. So that keeps the data and helps in future and better recommendations for pregnant and lactating mothers. So keep that in mind, but do go get vaccinated. There's few cases where pregnant women have passed with the newborn, either born without the parents because of the single parent, or newborn died with the mother because of the severity of the infection. So don't let that happen in this day and age. So encouragement to go get the vaccination is important. So myocarditis and pericarditis, this is what it is. It is inflammation of a heart or the outer layer, outer covering of the heart that has been observed in Moderna and Pfizer shot. It should not deter you from not getting the shot because these are self-limiting and they go away. Usually seen in people, males and between under 30. So if you're 30 years or younger, you may have you might experience these kind of symptoms. You may not, on the contrary, a lot of people who got in that age group never experience any of that. However, you can get these symptoms. So if you had the Pfizer or Moderna vaccine and you're having chest pains that are not going away and getting progressively worse, the shortness of breath and other symptoms, do seek medical attention. It may be that you may have one of the above conditions, which, like I said, is self-limiting and goes away more quickly than you would know. It's unclear how this happens, but it's been noticed. So if you did have the myocarditis after the first shot, do talk to your healthcare provider about your possibility of getting a second shot so that they can be a little bit more cautious about giving you the shot based on the first shot's reaction of the above. But most of the times they've been experienced by after the second shot, not after the first shot. Currently, the news I was reading the other day, the Finland has put a hold on Moderna right now for people under 30, so they shouldn't get that because of the above reason. However, Finland's health system is different than ours. Ours, we've seen with a lot of vaccinations that very few numbers of people develop these kind of symptoms, and they were all self-limiting. So it shouldn't discourage you from getting the vaccine. Guillain-Barré syndrome, it's one of the symptoms or diseases, neurological disorders that you get from flu shot. And since Johnson & Johnson's, in my earlier conversations when I had with the other presentation, mentioned that it's based on the flu vaccine platform, it also shares the same concern of Guillain-Barré syndrome. So people who are allergic to flu vaccine or had a prior history of Guillain-Barré syndrome with the flu vaccine should be cautious and encouraged not to take the Johnson & Johnson and choose other two instead. That would be less side effect provoking for these kind of situations. Bell's palsy is another concern that also happens with the flu shot too, which is also seen in Johnson & Johnson. So this is the biggest thing that Johnson & Johnson was earlier this year was put on hold because of the increased risk of thromboembolic events, meaning DVT, blood clots in the lungs and legs that caused a lot of problems. There's also a syndrome called TTS, which is thrombosis with thrombocytopenia purpura. So usually basically a low platelets and increased blood clots in your body that can happen as part of the reaction from the vaccine, mostly seen with Johnson & Johnson. So people with a history of blood clots and people with heparin-induced thrombocytopenia or TTS syndrome, the recommendations is not to get Johnson & Johnson and try to get the other two, Moderna or Pfizer, to get a safety-wise. Also, since people want Johnson & Johnson because of its charm of one shot, if they're adamant about just only getting one shot for the vaccination, and they think that taking an aspirin or any kind of blood thinner before taking a Johnson & Johnson would prevent that, it is not recommended at this time because the side effects of those medications are far more greater than the vaccine, and it's still there's no guarantee that they will get the blood clot or not. So the new chapter on the horizon in Corona saga is COVID pill. So Merck is right now the leading the race in the pack by this drug called molnupiravir, which is right now in the stage 3 of the trial, and it is showing a lot of promising. It is very good tolerability and least amount of side effects, and it cut down the hospitalization by 50%. So you might see a day where we might just need to take a pill for corona rather than a needle. So stay tuned for that. I may do go over with these kind of options and later on as the more information and availability of these medications are more widely available. So right now, these are still in clinical trials, and it hasn't been approved by FDA. So don't go ask your doctor about asking for a pill for corona, but just because you heard it on this seminar. Pfizer is also doing the same thing as Merck is doing. Their pill is also in a phase 3 trial. And we might soon hear that Pfizer come up with a pill too for corona. Same as that, the other pharmaceutical companies like Roche and Etiquette Pharmaceutical that are also doing their own trials for a corona pill. So this is like an emerging venue for corona. First was the vaccine and now this. So we may soon have a lot more arsenal to fight coronavirus. So kind of same way as flu virus, we have Tamiflu for flu virus, which kind of lowers the disease intensity. Same thing with this pill, we might be able to do the same with coronavirus, hopefully one day. So stay tuned. So where to get the vaccine? So these vaccines are widely available. So these are a few areas that I kind of showed. If all fails, you can go to the delaware.gov and find out where you can go get the vaccine, and they'll guide you towards the nearest center. However, you can also go to CDC, which will ultimately bring you through your state website to the places where you can get. So getting a corona vaccine is very easy these days, and because there's no shortage of vaccine, we should take advantage of all this and get it as the earliest. And people who are eligible for boosters should go get their boosters too if it's been 6 months. So the booster, one thing is that it is, I'm gonna say that it is same as the original vaccine. It's no different. A lot of people say, what is different in booster? The booster is the same as the other 2 doses of the vaccine the Pfizer has. So it's just to provoke the body immune system enough that it stay constant, vigilant. So it has nothing different other than the original vaccine. So keep that in mind. A lot of people have that question. So I just wanted to say that in this presentation at some point in time that it is the same as the first 2 shots. So VSafe program, I mentioned that earlier. It is, you can log on and get attached to it after you get the vaccination, and keeps track of any kind of side effects. And if you are enrolled, usually if you need additional dosing boosters, it'll kind of guide you when you'll be ready and stuff like that. So take advantage or look into it of this extra resource that CDC and your state has been putting it out there, so that they can help you make better decisions and guide you towards what you need to do. VSafe is used for health check-in. It is open for anybody age 12 and older. It monitors vaccine safety and also gives you vaccine reminders. VSafe does not give medical advice, so don't expect that you can get to talk to a doctor with that. And it cannot schedule your vaccination and stuff like that. You still have to go through the government website and register to even for boosters too, just like you did with the first shot. And if you haven't gotten your first shot, you go to the website and register first before they can tell you where you can go get your vaccine and which vaccine you may be getting. However, VSafe does not keep official record of vaccination. So keep that in mind. that you cannot get your vaccine records from vSafe. However, it does keep track of all the data that the people who got vaccine are collecting. If you lost your vaccine card, so a lot of people have been had their vaccines earlier this year, and they put it somewhere very safe that now they can't find it. So or they dropped it, or they washed it with their clothing in the home, and unfortunately, for those people who can't find their vaccine card or don't have anything, I put down this resource, this website. So to go get their immunization record, just so that they can show, because a lot of people have been asking for their vaccine cards for kind of access into those facilities and stuff. So if you can't show your vaccine card, or if you're traveling an airline and you need to show your vaccination status and you can't find it, this is a good resource to go find your vaccine card. Delaware, the Delaware Health Department does not replace vaccine cards. However, they can help you get your vaccine status checked through these kind of websites. I've mentioned that, and also if you don't have computer, you can always call this number that I've mentioned in the slide to call them and get your vaccine status checked and get some sort of a confirmation. Usually it works within regular business hours, and on weekends may take up to 48 hours to get your vaccine records confirmed. So take advantage of this. This is very important. I thought it'll help a lot of people who don't have the vaccine cards, and they're worried about what to do now that they can't prove their vaccination status. So people with needing assistance on vaccination, this is the number. I kind of put it in there. So I did mention earlier that they can go to those places. However, if you are not tech savvy and you don't know what to do, there's a number, I put it on the screen for Delawareans to call and see if they can help you guide where you can go get the vaccine, or if you need assistance in vaccination process. Questions about coronavirus. If you have general questions, you can always call this contact Corona. This is our beautiful state's, good taxpayer dollar, trying to get you as much informed about Corona or concerns about Corona clarified through these numbers. So keep that in mind. These numbers or the website, the hours are important because you can contact them through those hours. So together with the power of knowledge, we can beat Corona. I believe that can happen one day. May not be right now. So get vaccinated. Stay tuned for more latest developments like Corona pill, which I mentioned that in this topic, and fight against Corona. Thank you for your support, and stay safe, everyone, and get vaccinated. Thank you. Now, I think I'll open up for a question and answer. If you guys have questions, please relay that to me, and I'll try to answer them as best of my knowledge.
Dr. Shanawaz, starting from the last thing that you mentioned, that we can establish someone who lost their vaccination card.
Right.
Does the government give anything in writing?
So yes. So you can get a confirmation. You may not get a lost card, but you may get something in writing that will confirming your vaccination status. So that can be a very good resource, because a lot of people got their vaccines in January and February when it first came in, and they may lost the card, and now there's time for a booster, and they have to show what vaccine they had, or they don't remember. This slide, that's why I put it up again on the screen, is there to help them confirm what vaccine they got and when did they get it. So that'll give them a little bit of more relief that they got the right vaccine, because right now only Pfizer is approved for booster and other ones are not. So if you got Moderna and don't remember whether you had Moderna or Pfizer and you want to get a booster, well, you can't prove it. So calling this number or going to this website usually helps you kind of confirm what you had and when did you had it, and it may take a little time because they have to do their due diligent research about your vaccination status. However, they'll get back to you, and then you can take advantage of booster through that. Or if you're traveling like airline for something emergency wise and you can't find your card and you need something, you can always get that and try to get your vaccine status confirmed. So
can the medical offices started requiring that when people go for visits that they show them vaccination card?
Not really, because the thing is that if you're vaccinated, a lot of places have recently been opened up, so they're a lot less like security or scrutiny wise as far as that. But with the Delta variant and other variants on horizon, it may change in future. However, right now they're not requiring to show vaccine card. However, in my practice, I encourage people to bring their vaccine cards so that they can be part of their permanent record. That way, if they lose it or not, we have a picture of that card that we can provide back to the person so that they can have more than that. Also, people who just got vaccinated or got vaccinated in the past and they still have a card, I encourage people to take a picture on their phone, because we carry our phone all the time, most of the people and most of the days. So having that also on a phone, which can be saved, can also, because when you're trying to prove your vaccination status, all you have to do is show. Recently, my hospital required me to show my vaccination status so that they can update my records. So I didn't have the card at that time. I had it at home. However, I did took a picture on my phone and I sent them through the phone, and that was enough for them to say, yes, we'll accept that as a confirmation of vaccination. And however, the other physicians who couldn't, they were put on probation by the hospital until they provide the vaccination card. So that's why it is important to have more than one place your vaccination card available so that you can tap into it, that resource, and get it and confirm it right away.
Do you know if the airlines are demanding that too?
Most airlines, they do require, however, they're still in the phase of testing. So if you show the vaccination card, there'd be a lot more lenient on you being tested or not. However, they're still requiring that for right now, because airlines or airplanes are closed chambers where there's a recirculated air. So people who are not vaccinated, even though they're negative and they're not symptomatic, or they had the test that they were in incubation period where they failed to capture their immune status and they actually had coronavirus, they can infect a lot of people. And just because you had vaccine does not prevent you or keep you from getting corona. You may still get corona even if you're vaccinated. However, with vaccine, your timeline for coronavirus and the intensity of the virus disease process is going to be a lot lower and less. And there's a couple of people that said, do organic food. If I eat that, will that keep me from getting corona? And one of the questions I just got. And that is also not true. Keeping organic foods helps your immune system boost it up. However, it does not prevent you from catching corona. So do go get vaccinated, even if you're eating organic. So you can still continue to eat organic food to keep your immunity boosted, or take vitamin C and vitamin D, all these supplements that are recommended to boost your immune system. However, vaccination is the outmost big thing that creates more immunity against the coronavirus.
So, Dr. Shanwaz, we live in a private 100 homes community where only the community members can go to this clubhouse. They need a key. And some people say that we can gather there as group of say 6 to 8 people, and we are all vaccinated and we don't need any masks or per se not even 6 feet.
Right. So a lot of these guidelines have changed because of the vaccinations been going on, and the vaccination rate has been high. You can choose, if you're vaccinated, not to wear a mask. However, do also suggest that, you know, when you go there, the people who are cleaning that place, or, you know, may have used it prior to you going in. You know, Corona can survive on certain surfaces up to 3 days or up to 24 hours. So if somebody's been there before you and they may be non-vaccinated and they may be non-symptomatic and they touch those surfaces, there's still chance you can still catch that from those surfaces, even if you're wearing mask or no mask. So most thing is that if you're going in an enclosed place, make sure you still do the quarantine etiquettes. I would say, sorry, not quarantine etiquettes, but social distancing etiquettes, and do the mask, wash your hands, and try to, you know, stay 6 feet apart so that you can minimize this contact. Because the thing that this virus can cause disease in people differently. That's why we're not all same sick, because based on how our immune system is, we do tend to fight off virus, some people better than the others. However, if you take a chance, the probability of taking a chance can sometimes run out, and we may be sick even if you're vaccinated. So I think if that answers your questions, or, you know.
Yeah, in extension of that, some people wear masks. There are gatherings outside.
Mm-hmm.
Is that advisable?
Risk outside. So the thing that a lot of people take this social distancing etiquette a little bit too much, and some people take it too little. The truth lies in between. So common sense applies. If you think you're going to a place where there's a lot of people around, obviously, the more people, the more chance of exposure. Also, the more enclosed places you're going to, the most chance of exposure. So if you're going into like a high probability areas, the chances of exposure are higher too. So based on that, you know, I can say that if you use the common sense, it would say do the social distancing etiquette. If you're going in a place where there's, you know, less chance or less risk of catching corona with the, you know, 1 or 2 people, and that's open, you know, open air situation where you're going, I think the chances of that is less. Catching corona, there's still be chance, but it'd be a lot less. So, you know, it all goes with the probability. The higher the probability, the higher the risks are of catching it, even if you're vaccinated.
So, Dr. Shahnawaz Khan, it seemed like people, either because you answered everything almost, so they are being a little shy.
Yeah, I have another question that somebody just texted me, and they said, is taking the vaccine a prevention from getting long-term side effects? So the thing that long-term side effects has not been known yet, because vaccine's been only out for a year. So we already know the side effects within a year time frame with all the people who've gotten it. And like I mentioned, that with Moderna and Pfizer, myocarditis and pericarditis, which is inflammation of the heart muscle or the outer layering of the heart, is the most common one. I mean, local infections, injection site pain, swelling, fever, all those things are just side effects that are short-lived. But you know, the myocarditis and pericarditis are also self-limiting and short-lived too. However, with Johnson & Johnson, the blood clots and all those things, those are some serious side effects. So before you're getting that, if you have any of those conditions, or you're more prone for that, you know, if you're also a smoker too, which also increases the risk of blood clots and stuff too. you may want to rethink about choice of Johnson & Johnson and on that basis. However, if you have nothing available and only Johnson & Johnson's available, then go ahead and go get that too, because Corona is far deadly in most cases. And right now we're seeing a surge in southern states in Florida, Tennessee, Alabama with the Corona, because the people are unvaccinated population is pretty high out down there. And they were having a big surge right now. So my thing is that go get vaccinated at the earliest. The side effect wise, we'll know as the time comes, more data and more side effects. That's why I said the V-Safe program, as I mentioned in the slides, that's also helps keep track of all the side effects and all those things. So if you register and you have with that, you can also put it in your symptoms in there. And hopefully in next slides, if something major comes up, I may mention that too. So,
hey, Dr. Shanwaz, we are coming close to Maghrib time. So I want, unless you have another question on your text messages, do you?
No, I think I'm done. If anybody else has it, I'm here. If anybody who knows me in community wants to come and approach it later on because, they wanted to do a personal question about Corona or vaccines or my presentation, more than encourage them to come and ask me. I'm going to try to answer them with the best of my knowledge. However, when they get vaccinated.
Sure. So I really liked the way you presented, you addressed everything, very thorough, good references, good telephone numbers to use as needed, and that V-Safe program. I'm sure the community will benefit from all this, and Jazakallah khair.
Assalamu alaikum. Everybody be safe. Assalamu alaikum.